You're listening to the Move to Value podcast, powered by Chess Health Solutions. The Move to Value podcast is dedicated to helping healthcare providers understand and make the transition into value-based care. We do this through conversations and the sharing of innovative ideas with practitioners, experts, and leaders throughout the healthcare industry. Our mission is to sustainably transform the healthcare experience for the patient, provider, and care team by cultivating a value-oriented, compassionate, and health-aligned community. In this episode, Kari Curry, Medicaid Care Coordination Hub Supervisor at Chess Health Solutions, shares how Chess delivers high-touch, high-impact care management within a Medicaid Clinically Integrated Network. Kari walks us through a patient journey that highlights how Chess uses real-time data, comprehensive social determinants of health screening, and structured care planning to reduce ED utilization and improve health equity. She also covers Chess success with AMH Tier 3 audit readiness and payer collaboration, proving that value-based care in the Medicaid space is not only possible, but measurable. Kari Curry, welcome to the Move to Value podcast.
Thank you. I'm happy to be here.
So, Kari, can you describe your role as a Medicaid Care Coordination Hub Supervisor? And for someone who might not know what a Care Coordination Hub is, how would you define it in just plain terms?
Well, at Chess, their care coordination represents the section of the company that includes, patient calls, case management. Care coordination is the large umbrella, and then under the umbrella is the Medicare Hub and the Medicaid Hub. So Hub just means team of individuals. So both the Medicare Hub and the Medicaid Hub make up the care coordination department within Chess. So I supervise the Medicaid care coordination team.
That's great. So you would be the one to talk to then about some of these topics that I'd like to learn more about. And I'd like to maybe get a better understanding through this from the journey of a patient, a made-up patient. And so let's say Maria, our patient, is a 48-year-old woman, recently discharged from the hospital after diabetes-related complication. So she's on Medicaid, has limited transportation, and struggles to keep up with her appointments. Where does her journey with your team begin?
Well, we get notified through our documentation system when Maria is discharged from the hospital. So we will get that notification. And our team will actually attempt to contact Maria within 48 hours of discharge to follow up with her and discuss case management services and how it could benefit her. So that's where the journey truly begins, is when we get that notification.
So, Kari, when you first hear about someone like Maria, can you tell me more about what outreach and follow-up look like in her case, or a case such as hers?
Sure. So we are integrated with the NCHIE, which is the North Carolina Health Information Exchange, and receive near real-time notifications of discharges within our documentation platform. So in our platform, we get what we call the ADT feed, which stands for, admission, discharge, transfer. The ADT feed is updated in our platform daily, and we strive to be on that real-time notification. So the members of the Medicaid team will outreach Maria, like I said, within 24 to 48 hours. Our team aims for 24 hours for the patient who is discharged, but we allow 48 hours.
That seems pretty fast. Good work.
Mm-hmm.
And once that contact is made, then what happens? Walk us through what that initial follow-up might entail.
Sure. So once the team has contacted Maria and discussed the reason for, our call and the benefits of care management, that's when the real work begins. So Maria can agree to services or she can decline. That is her choice. In Maria's case, she does have some issues with transportation and keeping her appointments. So those are things we can help her with to ensure that she's receiving the best care despite the barriers. So once Maria agrees to the case management services, an initial health risk screening is completed. In the initial health risk screening, there are questions related to social determinants of health, such as issues with food, housing, utilities, transportation, interpersonal safety. This is where the care team will see that she needs help with transportation. So the care team will provide her with transportation resources in hopes to eliminate that barrier for her. Then the question arises to why Maria is struggling to keep her medical appointments. Is the lack of transportation the reason, or is there something else preventing her from attending those appointments? This is why it's important to ask those questions around social determinants of health. If Maria is agreeable to care management services, the care team will go on to complete a comprehensive health assessment, which is just more detailed and includes health conditions and other things. So, along with the comprehensive health assessment, the team will complete a med reconciliation to make sure she's compliant with her medications and a patient centered care plan. So then a follow-up call will be scheduled to check in with Maria to assess her care plan progress and ensure she has transportation to her medical appointments.
You're overseeing a team managing people with some real struggles, it sounds like. What's your
Yes.
philosophy or approach to that care management?
So my approach to care management is meeting the patient where they are. You may have patients that you know really need to work on their health conditions, but they have a social determinant that is causing a barrier for them to focus on their health. Start with what's important to the patient, not us. So that's where we start.
Is that what makes care coordination work? I mean, in other words, what are some best practices you've seen that really move the needle for folks like Maria?
Making sure you're judgment free and letting the patient know that you're there to help. There is such a focus, like with patients, on being healthy and maintaining their health. But if the patient has barriers preventing them from managing their health, we need to address those first and get those resolved if possible. If the patient has the tools they need, they are more willing to work on their health conditions.
Yeah, that's definitely true. So, what kind of impact have you seen, and not just related to health outcomes, but on people's lives? And I mean, this can include the provider or the clinical team. What are your thoughts? What do you see?
With case management services, the number of emergency room visits can decrease. Patients are aware to contact their provider office before going to the emergency room. They know when to go to the emergency room. So, having appropriate care and medication compliance can decrease the cost in healthcare. There are so many benefits to care management services. We also have our patient engagement coordinator who provides resources to patients with social determinants of care, which has made a significant difference linking patients with the community agencies.
Well, Kari, let's talk about your favorite subject. Let's talk about audits. Um,
Okay.
I know that you're a star at Chess for your work in that area, and so I'm relying on your expertise to just let us know what are they, what do they matter in Medicaid, and has an audit ever revealed something surprising or maybe an issue or a success that you didn't see coming? Tell me all about this.
I love audits. Um, to be an AMH Tier 3 provider, you must follow the requirements set in the Advanced Medical Home Manual, which is provided by the state. So, our documentation platform includes all the AMH requirements. And I have audits with each of our health plans to ensure that our documentation meets the requirements along with policies and procedures. I'm happy to report that Chess has passed all their audits with the health plans. Um, but I've been doing audits for a long time. And once managed Medicaid went live, it was a new process, not only for health plans, but the providers as well. And I was working at another organization at the time, and we had our first AMH Tier 3 audit. So didn't really know what to expect. And we did really well on the audit. However, we found that the dental question within our platform was not listed as a required question. So we had some care managers who were not asking the patient if they had been to the dentist in the past year. Well, that's a requirement. So we were able to go in there and get that dental question in the platform to be a required question, and all was well. And I think audits can also show trends that may be occurring with documentation that you may need to educate the care management staff on. So it's a great tool at the same time. I know it can be time consuming, but it's also a great tool just to monitor the care management team.
Outstanding. So how do you prepare for audits, and what does a successful audit look like? I mean, I know you just mentioned about the dental question, but are there other common pitfalls or lessons that you've learned from past audits related to the process?
Audits, like I said, can take a lot of time, and it is a joint effort. However, it shows the great work that Chess is doing. I meet with the compliance team and data and analytics team to ensure that we have all the documentation needed for the audit, and whatever the health plan is requesting of us. And to pass all those audits has been a huge accomplishment for the Chess team.
Let's go back to Maria, our patient that we had talked about earlier. So it's 6 months later. She's attending her appointments, her blood sugar's under control, and she's joined a community wellness group. What had to go right for all of that to happen?
Removing the barriers that prevented Maria from managing her health is key. I also think follow-up calls from the care manager, checking in with her and discussing her care plan is also crucial. Maria knowing that we care and we are here to help her better manage her health can go a long way.
Kari, what would you want folks to understand about what it really takes to support someone like Maria? If everything works the way it should, what does success look like for her?
2 words: patience and support. Changes in a patient's health does not happen overnight. It takes time to build that rapport with them and remove those barriers with that patient. But once a patient sees a success with their health, it builds their confidence and it builds their self-management of their health.
What's one thing you wish more people understood about the day-to-day work of case management and care coordination?
It's hard work. You're going to have good days and you're going to have bad days. You may make calls all day long and get one patient on the phone. But if you can make a difference with that one patient, it's all worth it.
Kari, finally, what's something you've seen recently that reminded you why your work matters?
Well, I was working with a patient not too long ago who wanted to lose weight and she wanted to just be more active in general. And I mailed her information on food choices and the importance of exercise. And we had set a goal and started a care plan. So every month we would discuss her eating habits and her exercise routine. And after a couple months, she called me after she had gone to her doctor's appointment, and she was so excited. She had lost 5 pounds. And so we, of course, cheered her success. And she was excited about losing those 5 pounds. But she was more excited in the fact that she could take her kids to the park and play for longer periods of time without just getting exhausted. So in this job, you're going to have a lot of patients that don't want to work with you, or you may lose contact with them, or they decide they just don't want to work with you anymore. But when you have a patient that sets a goal with you and they are able to meet that goal and make differences in their life for a healthier lifestyle, it makes it all worth it.
Wow, that's awesome. That sounds like a really rewarding thing to have.
Absolutely.
Well, Kari Curry, thank you for joining us today on the Move to Value podcast.
Of course. Thank you.
This is the Move to Value podcast, powered by Chess Health Solutions. We hope you have enjoyed this episode. If you would like more information about this and other episodes, you can head over to movetovaluepodcast.com to check out all of the available resources. If you're interested in continuing to hear about value-based care and how it impacts you, you can sign up for our email notifications or subscribe to this podcast on your favorite podcasting platform. Also, we would love it if you would share the Move to Value podcast across your networks and leave a rating or review. Thanks for listening.